My name is Hermine Hartman, and I want to welcome you to Indigo Studio. Today, we're going to have a conversation with something that's kind of swept under the rug, yet it is a pressing issue. We want to talk about Black maternal health disparities. Did you know that in this country, Black mothers are 3 to 4 times more likely to die, that is, to die, from pregnancy-related complications at childbirth compared to their white counterparts? Did you also know that in the United States, this is the only industrialized nation with a rising mortality rate? That means lives, dreams, and futures are lost. And today we want to talk about this. We want to talk about it with women who are doulas, midwives, and doctors, because every baby should be born healthy and every woman should have a healthy baby. This is an interesting and necessary conversation.
Cozy conversations, dropping knowledge that's for real.
So today we're talking to Toni Taylor, who is a co-founder of Chicago Birthworks. It is an organization for doulas. We're also talking to Tenise Allen, who is also a doula and studying to be a midwife. All right, so ladies, first of all, you got to tell me what a doula is and what a midwife is. What's the difference between the two?
So a doula is someone who teaches you how to advocate for yourself in labor. A doula also is the one who's helping you through labor with like pain relieving techniques. And then the midwife is the one who is doing all the medical things. So giving you the prenatal care and delivering the actual baby and giving you care in postpartum. Like that's what your midwife is doing.
Okay, now how did you ladies become interested in this process, the doula process? How did you become interested? How did you found your organization of Chicago Birthworks?
Our organization was started between me and my daughter when she had her second baby. And we wanted to duplicate the support that I gave to her and the safety that she felt and manifest that for other moms.
And this is having babies at home.
Having babies at home or in the hospital. So we support in all.
So you can have the doula process in the hospital?
Correct.
Okay, so why would I want a doula rather than a doctor?
So the doula is not medical. The doula does not provide you with any medical, they don't perform any medical procedures, any medical anything. They will help you understand medical procedures. They will help you understand medical norms and different things like that and just how to move through the medical process. But doulas are not medical staff. We're more so like birth assistants. So doulas are the assistant to the midwives or family assistants.
Okay, so you're coaching.
Yes.
You're really coaching. Mm-hmm. So now with a midwife, can I have a midwife in the hospital or is a midwife off of the hospital at home?
So you can have a midwife in a hospital, which would be considered a certified nurse midwife. But you can also have midwives that are at home, which are certified professional midwives. The difference between the two is really the schooling. So a certified professional midwife would be in school for probably about 3 years, whether a certified nurse midwife is in school for about 6 years because you have to do nursing school, then you go to midwifery school, and you have your clinicals, and then you can become a midwife.
Do I need insurance to have a doula?
To have a doula?
So insurance, I mean, doulas were initially out of pocket, but they just passed a law and they're being provided.
As we talk about this, we find a disparity with Black women as compared to white women. Talk about those disparities.
So you have like racial bias.
In the hospital.
Oh, yes.
Yeah. Yeah. So you have racial bias. You have staffing that just aren't really informed about the nuances of caring for Black women. There was a video that was circulating saying that doctors were trained and they were under the belief that Black women have a higher tolerance for pain. And when we, so if this person is caring for me and I'm telling you that I'm in pain, you're not receiving this the way that it needs to be received, and you're not providing me with care sensitive enough to actually help me relieve what's going on.
So it's likely that the woman is not being listened to, not being
in
heard?
a lot of ways. In a lot of ways.
Is it sometimes the maybe the medication is not being administered properly?
I'm not going to say that it's the medication. I'm not going to say it's one thing or the other. I think it's a series of a lot of things that just happen over the time where you become pregnant through delivery.